So good morning, everybody. I mean, a very warm welcome to what I hope is going to be a real fun couple of days, reflecting on something incredibly important, I think for the UK, for our NHS and care systems, but I think also for the world. We're thinking about how we can leverage the developments in AI capabilities to really improve outcomes for multiple long-term conditions. For those of you who don't know me, my name is Aziz Sheikh. I've got the privilege of being part of the research support facility together with Monica Fletcher, leading the sustainability and legacy side of things. And on behalf of the research support facility, the RSF, a very warm welcome really to what's going to be a really important couple of days. So we're joined by around 120 people, travelled from all parts of the UK. So many thanks for making the journey. Realise that there have been some travel disruptions for some of you, but delighted that you're here. Another 30 or so people online, so very warm welcome to everybody online as well. And what we have in the room and online are in all sectors represented. So the public, the private, the charitable. I think really importantly, we've also got people with lived experiences of long-term conditions, multiple long-term conditions. So I think if all the speakers could bear that in mind, really, we want to really keep everybody on the same page in that respect. So just a bit of housekeeping before I introduce the co-chairs for this session. So Wi-Fi, please do connect. I mean, it should be, there is kind of Wi-Fi throughout this level. There are no planned fire alarms. So if there is a fire alarm, then please do follow the signage. Toilets, you should have passed. They're just by the lifts. And we will be having our sort of coffee break, etc., just where you've registered. So please make a note of that. In terms of interacting with the speakers, we can do this by raising a hand and a roving mic will come to you, or you can do this through Slido and there is somebody monitoring. So please just take a look at that QR code. And really we want you to interact. If there's anything that we can do to support, while you're here in any way, then please just ask at the desk or any of the organisers and we'll be delighted to try and help. And in that respect, what I did want to say is that there is a quiet room available if you need that. Again, you'll have passed that as you were walking through. And there is plenty of breakout space. So if you need to take calls, meetings, etc., please just say and we'll be delighted to try and support in any way that we can. So I think that's by way of housekeeping. And what I wanted to do is just hand over now to Aldo Faisal. So Aldo is Director of Science and Innovation at the Alan Turing Institute. Unfortunately, he's not able to be with us in person, but delighted that Aldo's able to join online. And Aldo's going to be speaking about health research and the Turing. So Aldo, over to you, please. Thank you.
Thank you very much, Aziz. I really appreciate that. And a very warm welcome also from me to you in Manchester. I'm really sorry I cannot be with you, but a healthcare situation in my family requires me to be at home. Good. I want to talk to you briefly about the Alan Turing Institute, which is the National Institute for AI and Data Science in the UK. And we are currently undergoing a transformation. And as part of this transformation, the Alan Turing Institute is restructuring into 3 major grand challenges we want to tackle. And of course, the one I want to talk to you about here is the grand challenge that I lead. It's the grand challenge in health. And really the challenge that we need to understand is how can we move forward from the wonderful beginnings that we had in this country. If you, I show you here a picture of John Snow, one of the founders of epidemiology, who basically invented data science to try to work out how cholera spread throughout London. And what he basically did is he started, tracking the cases of cholera in the streets of London and had this idea of basically charting by bars that he made higher the more people were sick in a specific house with cholera. He drew a first visualization of data, thereby inventing the bar chart to show where cholera cases were. And he had this hypothesis that cholera could be spread through water. So he also drew in the water pumps that were there, and he found that the water pumps clustered all around the central red water pump here. The cases were particularly high. And so he then decided to do a healthcare intervention. He shut down that pump, and you can still see the Broad Street pump in London now. And what happened after he shut it down is that the cholera epidemic in London was effectively stopped. And so it was a beautiful example of how using data, intervening on data, understanding what's happening, and then planning intervention and carrying it out and seeing the positive effect was effectively invented in this country almost 80 years ago. Oh, no, sorry, 180 years ago. So that's our beginnings. And I think if we want to talk about nowadays how we can do things, we need to talk about data and AI. But typically when people talk about AI, they think it's just for data analysis. But AI gives us also the opportunity for agency to do something proactively for our health, give the systems power to help us meet the growing unmet demand for health and care. And that's simply because we have limitations on the supply of clinicians. We have a dramatic explosion in diseases due to aging, due to climate change, due to pandemics, for example, that mean that we cannot meet the demand we have to meet. And so the idea is that AI can help us meet this unmet demand and find AI solutions that can help us substantially. And here the UK is in a very unique position. We have the wonderful NHS, which is a source of data and knowledge. And we have a wonderfully thriving life sciences sector that contains a lot of data from the genetics, the cell biology, to the physiology, all the way to the clinical data in the NHS. And if we can link these data together with the help of AI, we can really unlock not just innovation in solutions for the people of this country, but we can also probably develop solutions that the world can benefit from. And so our vision is to use this data sources and the close collaboration with NHS to help transform how we can build solutions for health and care using AI. And there are, of course, many problems and opportunities. I'm not going to go through all the details, but we know that by integrating services in a smart way, healthcare services, we can boost life expectancy. There's this idea that you can help people navigate the healthcare system with what we would call an AI Sherpa that guides you through, make sure that you do and go through the right follow-ups. We can help, of course, patients suffering from multiple long-term conditions by better understanding the disease, but also then thinking about how to proactively help them. In this conference today, we'll give you more details on that. We can also think about the care workers, for example. There's been beautiful examples where the deployment of AI in a radiology department that helped doctors cope with the demand of requests, reduced the number of burnouts in clinicians by over 50% through the proactive use of AI. And you can, of course, also compensate to a certain extent for the underinvestment that we've seen over the past few years by basically unlocking productivity more. So for us at the Turing, we are all about trying to use AI and develop AI tools with and for the NHS that can help the NHS shine again. Now, with all these wonderful news about AI that we're reading in the news and what it can unlock for healthcare, we're still seeing a number of gaps to make AI patient ready. So on the one side, we have a situation where medicine as a science advances so quickly. Just in cancer alone, there are almost 1,000 papers published every single day, that no single clinician who's treating patients, no single patient who's interested in their disease can just keep up with that. And we believe we can address this gap of knowledge and the growing amount of knowledge and the fact that individuals need to treat patients with the help of AI. And so we're launching in the Turing something that we call a knowledge mission that will help us manage the mission. Another aspect is that a lot of AI quick wins in the last few years focuses on diagnosis of disease. But of course, once you've been diagnosed, you want to be treated and you want to get well. And so the focus for us is here to move beyond diagnosis and see what we can do in the domain of AI-based treatment, supporting doctors, nurses, and care workers in helping you treat better. And that's what we call the action mission. How can we use AI to support your treatment? And finally, we're seeing a lot of innovation happening in the space of AI already, thanks to generous funding from the government and a lot of activity in the NHS side. But a lot of the methods that are being developed are not clinically validated. And methods that have been, for example, developed in one hospital don't work in another hospital. And that's what we call the translation gap, the ability to take methods that somebody develops all the way to actually helping patients and getting it prescribed. And so to address this gap in the translation process, we're also launching an impact mission. So with these few introductory words, I just wanted to show you how we at the Alan Turing Institute want to engage with that. In my subsequent speaker, Kirsty Whitaker, who has been leading on the AI multimorbidity program in the Turing, is going to show you what we specifically did in the past. And I'm looking forward to working with all of you to see how we can carry this on in the future. Thank you very much.
Thanks very much indeed, Aldo, and thanks so much for joining.